And here's Gladys.
Good morning, everybody. In the week ending Saturday, so Saturday week, New South Wales had 834,000 people come forward and get a jab. That is an outstanding result. It's broken all our records. And I can't thank everybody enough for coming forward to getting vaccinated. As a result, 65% of our population have had at least one dose, and 35% of our population is fully vaccinated. So we're halfway to that magic 70% number across the state in order to have those extra freedoms. To 8 p.m. last night, there were 1,218 cases of community transmission, and we extend our deepest condolences to 6 families of loved ones who died from COVID or who had COVID. 3 people in their 80s, 3 people in their 70s, 4 of them were unvaccinated and 2 of them had only had 1 dose of the vaccine. So again, we extend our deepest condolences to the family and loved ones of those 6 individuals. Obviously, Western Sydney and South-Western Sydney remain those most areas of concern in Greater Sydney, and Western New South Wales remains the greatest area of concern in regional New South Wales. At this stage, as we said, double dose 70%, which will give us all freedoms. We expect to land somewhere during October. But the next big target that I want us to achieve as a state is to get that 70% single dose vaccination, because then we'll have confidence as to when we're going to land that double dose. And I especially wanted to say today how much I think every day about all those families in Western and South-Western Sydney who are living under very strict lockdown conditions, and that we are mindful of that and also mindful of what we can do to relieve the stress on families during this time. And I look forward to seeing those vaccination rates go up again. But thank you to everybody who's been coming out to getting vaccinated. Today we have a super day encouraging people to wear the colours of their sporting codes to come forward and get vaccinated. But I also wanted to say a special thank you to community leaders, non-government organisations who've worked with us to support those higher vaccination rates. We're now leading the nation, and we want to obviously continue that because it means greater freedom for all of us. So a big thank you and keep going. Dr. McAnulty.
Thanks, Premier, and good morning, everyone. It's fantastic to see the ever-increasing vaccination rates across the state, which is very important for us to conquer this, live with COVID. With the numbers, there have been 1,218 locally acquired cases of COVID reported in New South Wales to the 24 hours to 8 o'clock last night. In addition, there were 3 overseas acquired cases. There were 106,038 tests reported to 8 o'clock last night, compared to the previous day's total of 129,182. Unfortunately, we're seeing large numbers of people in hospital with COVID. 813 people are admitted at the moment with COVID into New South Wales hospitals, including 126 in intensive care and 54 who require ventilation. Of those 126, 113 were not vaccinated and 12 had received 1 dose of vaccine. Sadly, as the Premier mentioned, we've seen 6 deaths of people who've had COVID. A man in his 80s from south-western Sydney died at Nepean Hospital after acquiring his infection there early this month. He's the 5th death linked to the outbreak at that hospital. He was not vaccinated. A man in his 80s from Sydney's inner west died at Concord Hospital. He acquired his infection at Wyoming Aged Care Facility, and his 5th death linked to that outbreak. He was not vaccinated and had underlying illnesses. 2 men in their 70s from south-western Sydney died at Liverpool Hospital. A man in his 70s from Western Sydney died at Westmead Hospital, and a woman in her 80s from Western Sydney died at Westmead Hospital. I express my deepest sympathy for the families and friends of these people who have died. We continue to see the highest rates of cases in Western and South-Western Sydney, but other parts of Sydney, of course, are also affected, in parts of Western New South Wales and the Hunter. Where suburbs with most cases and we're most concerned about continue to be around the areas of Guildford, Merrylands, Auburn, Greenacre, Bankstown, Punchbowl and Blacktown. Our ongoing sewage surveillance system has detected some further pings or positive fragments in some places where we don't have identified cases in regional New South Wales. These include Trangie, which is just west of Dubbo, Byron Bay on the north coast, Temora in southwestern regional New South Wales, Cooma and Tamworth. We're concerned that there may be cases unrecognised in these communities, so please come forward for testing if you have even the mildest of symptoms. We want to make sure that you're cared for, but also your family and community are protected if you do happen to have COVID. We've also seen positive tests in Tukli on the Central Coast. We continue to be concerned that everyone on the Central Coast is aware to come forward for testing if they have the mildest of symptoms. In Western New South Wales, yesterday we saw 2 new cases in Wilcannia, and in Dubbo, 18 cases, Burke 2 and Narromine 3 cases. Thank you very much.
Dr. McAnulty, just on that side, I'm not sure whether I misheard or not. You're talking about the number of people in ICU with either had either no vaccination or one. Is it correct to say that there was one person who had 2 vaccinations?
Sorry, yes.
How rare is that? And were there any underlying causes? What explains somebody in ICU who has had 2 vaccinations?
Yeah, so I'll just give the numbers again. So of the 126 people in ICU, 113 are not vaccinated, 12 had received their first dose of vaccine, and 1 person had received 2 doses of vaccine. The vaccine's great. We know it's around 90% if you're fully vaccinated of protecting from severe disease, hospitalisation and death, but it's not perfect, it's not 100%. So unfortunately we do get breakthrough infections sometimes, even in people who have had 2 doses, but it's uncommon, and we're seeing most people having had no vaccine or perhaps just 1. But the message is really important, that vaccinating yourself is important for you and your own health, but we all need to maximise vaccination to protect the people around us. Our family, our friends, our elderly relatives who may not be vaccinated, but importantly our community and our frontline health workers who, despite being vaccinated, remain at risk if they come into contact with people because it's not a 100% effective vaccine. It's a great vaccine, but there are some breakthroughs that occur.
The Chief Medical Officer said this morning that the vast majority of children in hospital with COVID aren't there because they're very sick, but because their parents are in hospital and they need care. Is that the situation in New South Wales?
I don't have the exact figures, but certainly there are some people go to hospital for a variety of reasons, and we in the special health accommodation, for example, we do provide accommodation for people in families, including children and adults if there's a case there, and certainly in situations where there's a need for children to be looked after, then the health facilities will take that into account.
Do you have any records of how many of the new 1,200 or so cases today have had 1 or 2 vaccinations or none? Is there any?
I don't have that with me. We do on a weekly basis publish our epidemiological report, which provides information on that level of detail, so we can get back to you on that.
Dr. McAnulty, there's been a change in language recently where we've started saying that people are dying with COVID, not from it. Could you just explain why that is?
It's often very difficult to know when a person has COVID and then they die, how much COVID contributed to the death, sadly. We know when elderly people die, they can have a range of comorbidities, and of course being old increases your risk of death. Now, COVID may often play a role in the death, but may not. Sometimes some of our cases who have sadly died appear to have recovered from COVID, and then they have died of something else. So to make it simple and to understand, we report people who have died essentially with COVID, unless there's a very clear alternate source of death.
There will still be cases where you know for sure that they died of COVID, but in other cases to be safe.
Exactly, it's a mix, and it's often very difficult even for the doctors looking after to know how much COVID may have contributed to the death.
We understand that there's at least a dozen inmates at Parkleigh Prison who have tested positive. Do you have any more information about how it got in there? Because we understand that they're inmates that weren't on remand.
Yeah, so there's 31 cases associated with Parkleigh at the moment, where the prison health authorities, which is through St Vincent's Hospital, provide support for the correctional facility, are working very hard to make sure that the other inmates and staff are protected. My understanding is that the initial investigation suggests that it was initially introduced by somebody from the community, who probably acquired it in the community, and the investigation is ongoing to both understand how transmission has occurred in the community, in the prison, but also to make sure that the isolation, testing and vaccinations are in place to minimise further spread.
Do you know? Same Silverwater prison as well? Similar cases, a minimum of 16 at Silverwater prison?
I don't have the exact numbers in Silverwater, but the Justice Health has a special service for looking after patients with COVID, so that they're essentially in a ward there.
That's right. Do we know the vaccination status of people in prisons? How that roll up?
I don't have the exact details, but I know it's a very important strategy is to maximise the vaccination of workers in prison, both health workers and people who are working in the prison, as well as offering vaccine to inmates. So, like the rest of the community, it's important we maximise vaccination, but particularly in settings where people are living close together, such as in prisons where there's a large number of people who are essentially restricted, maximising vaccination rates in those sort of settings is really important.
Doctor, you've got 813 in hospital at the moment, about 120 odd in ICU. At what point do you get to that number? If that number increases, at what point do you start going, I'm starting to get really worried about us managing these cases? It seems like a lot of people.
Look, it is a lot of people, and fortunately in the last several years, but particularly with COVID striking, there's been a lot of detailed planning across the health districts to make sure that there's capacity for additional people who, should they need intensive care and to be in hospital, and additional ventilators and so on put in place. So there's extensive planning being done at the state level and local level to manage additional cases.
We shouldn't be worried about that number doubling or whatever?
We're always worried, and our aim is, from a public health point of view, is to minimise people with infection and particularly protect people who are more vulnerable and therefore may require hospitalisation or ventilation. And again, part of the strategy is the current lockdown, the contact tracing we're doing, but really importantly is the vaccine. So we know that the vaccine works much better than, say, flu vaccine in preventing COVID and complications of COVID than flu vaccine does in many years from preventing influenza complications. So, the key is get vaccinated. We still have a lot of room for improvement while we've got great rates in the older people with vaccination, there's still room for improvement. There, as we've seen today, there are a proportion of people who are at particularly high risk of complications who haven't yet been vaccinated. So clearly, please go and get a vaccine if you haven't already done so, both to protect yourself from going to hospital, but protect from transmission to other people as well.
The other night we saw that a testing clinic at St Mary's was damaged by fire. Do people in that area who were swabbed yesterday need to be worried that their swabs have been damaged, or they have been processed somewhere else overnight?
I don't know the details of that. Typically, what happens is there are couriers that go from clinics to the laboratory on a regular basis. We'll have to get back to you about that detail. I just don't know.
Western New South Wales has remained an area of concern. We're hearing reports from people there saying that there are times where they're being turned away from going inside the clinics. There's limited resources. Nurses are also the AMBOs. Are you confident that Western New South Wales and Wilcannia is equipped to deal with what's happening there?
Look, remote areas have particular challenges, but we have surged enormously in our ability and with our staffing. We've sent teams out to assist in both Dubbo and Broken Hill, and we've also got additional assistance nationally and through the military to assist in the far west and western New South Wales. So look, it's a vulnerable communities. There are challenges of distance and in some communities of crowded housing. So there are across government is working together to address these really challenging problems and to do the utmost to keep the community safe and also to make sure that we're minimising the risk of further transmission in those communities.
There's 1,200 cases today. It's a huge amount of things we've ever seen. Last week you said that you don't want people to get upset by these numbers, that they will bounce around. But There are also a number of people who are concerned that you are not so alarmed by these growing numbers of cases. What would you say to those people?
I'm incredibly alarmed by anybody that needs hospital care or is in intensive care. And that is the figure that we need to look at, because what we're seeing, not just in Australia but around the world, is that the vaccines are providing enormous protection for people. As we've seen, out of all the people in intensive care, there's only one person who's fully vaccinated. So that is really important to have in mind. And yes, the case numbers are always concerning when they're going up. We'd love to see them coming down. But that is not the most relevant number for us. What is the most relevant number for New South Wales is how many people are vaccinated and how many people are we keeping out of hospital and out of intensive care. And that is what is really important for us moving forward. There's no doubt that we have to come to terms with living with this virus. And the best way we can do that is by protecting ourselves and our loved ones, by having high vaccination rates. And I said a number of times, I don't want people to go through the daily roller coaster of case numbers going up and down. Of course it's concerning when they go up instead of they go down. But the most relevant number is what is the vaccination rate, because we know that that provides enormous protection. But what it's also doing is reducing the potential of the growth of the virus. It's reducing how quickly the virus is growing. So in other countries around the world, you see a doubling or tripling of cases every day in highly unvaccinated populations. But what we're seeing in New South Wales is that the vaccines are holding up really well. Our hospitalisation rate is actually declining. The people in intensive care would have been much, much larger had we not had a race on to vaccinate our population. And please know that, of course, the challenge for us remains having a manageable number of people in intensive care moving forward, and that relies on all of us getting vaccinated. Once you get to 70% double dose and 80% double dose vaccination, that gives community enormous protection against going into hospital, which is why we're looking forward to providing freedoms for our population once we get to the 70% double dose.
Aren't case numbers going to matter when it comes to looking at areas that can send their children back to school? I mean, that is part of the return to school plan.
Well, obviously, we look at all those things, but if you have a high rate of vaccination amongst your adult population, all teachers are fully vaccinated, schools are a very controlled, safe environment, of course we'll take the advice from health. What we don't want to see is schools disrupted all the time because of cases cropping up. So obviously, if there's a particular local government area that has a really high number of cases, well then obviously health and the Department of Education will make decisions around that. But it's way too early to make assumptions. I don't want anybody in Western or Southwestern Sydney feeling as though their child won't be able to go to school. Quite the contrary. We are always optimistic about what the opportunities are for our children, and I know how stressful home learning is for our population. So I don't want anyone to get too ahead of themselves. We still have some time before we hit that October 25. What we have demonstrated, though, as a government is striking the right balance. We'll often draw criticism because we want to make sure we provide people with as much opportunity as possible, but safety as much as possible. And safety and public health is always our primary concern, but also getting the balance right when it's okay to provide people those opportunities. Living with the virus is what we'll be doing. Living with the virus is the way New South Wales has the opportunity to show the nation how it can be managed, even if you have a relatively high number of cases.
Yeah, you've mentioned previously that when we hit that 80% vaccination rate, that's when you'll start focusing on hospitalisation and deaths as opposed to the case numbers?
It's actually 70%, yeah.
So today we're at 35%. Is there a change in strategy as to why you're asking people to not focus so much on the case numbers?
No, not at all. What I'm encouraging all of us to do is start preparing for when we do live with COVID. When we get to that 70% double dose, we are all going to have to shift our mindset as to how we deal with COVID. What will matter the most is keeping people out of hospital and measuring intensive care patients and hospitalisations as opposed to the number of cases. And that's the recommendation that's come through from the Doherty report. We'll be doing a lot of things differently when we hit 70%. We'll be transitioning from the way we think about COVID now to how we live with COVID. The way we deal with quarantine will be different. The way we deal with how we move around will be different. But it will be a much freer experience than what all of us are going through now, but it will also be an experience where those that are vaccinated will have greater opportunities to live freely, and that's why I do want to encourage everybody to get their vaccine for themselves, for their loved ones, but also for the greater community, because there will be opportunities for those who are fully vaccinated to live more freely at 70% double dose. There are some things we cannot extend to people that are unvaccinated because it still poses a threat to the greater community. But obviously once we get to 80% double dose vaccinations, there are other opportunities there as well.
Can I ask about liability for employers? There is a degree of confusion about employees leaving the hot zone LGAs and going to work, requiring at least one vaccination. Where does the legal liability lie for the employer to have somebody on site who does not show proof of at least one vaccination?
Well, obviously we want both employers and employees working together to make those vaccination rates possible, and it's to provide safety for everybody. We know, every day all of you get to hear the message about workplaces and households being the two places where the vaccine is spreading. So we've learned so much in the last 6 or 7 weeks. We know how and where the virus is spreading. And we can't get around the fact that authorised workers provide all the essential things that we need to live. But unfortunately, that's how the virus is spreading. And that's why we're asking industry and employees to work together, work with us to make sure we increase those vaccination rates, and that will keep everybody safe, including your own loved ones.
That is a common goal, but I'm just wondering where the legal onus is for employers. Do they have the right to refuse somebody? Do they have the right to ask somebody for proof of vaccination? Can they be prosecuted if they have somebody on their
I'll have to defer to the legal experts, but what we've already seen, which is what we're likely to see more of, and I really want to make this point clear, many companies, organisations, workplaces are making their own decisions about saying nobody who's unvaccinated is allowed to work for us. And I suspect that once we hit 70% double dose, many private businesses might make decisions to say, I don't want anyone who's not vaccinated coming to use my premises or coming to use my services. Now, they're personal decisions, and it's all about choice. If you want to remain unvaccinated, that's okay, but don't expect to have the same freedoms that vaccinated people have. We're all subject to choice. And if you want to move around more freely, if you want to enjoy those things all of us have been denied, get vaccinated.
Sort of thing. Sorry, Mark. Just one more follow-up. Is that the sort of thing the government should be more proactive with? There are a lot of employers out there who have people deemed authorised workers coming out of those LGAs, and right now they're in limbo. They don't know what their legal rights are. Can the government be proactive in maybe explaining that?
Well, we're making it very clear. You shouldn't be welcoming anybody on your premises unless to work unless they're following the health guidelines at all times. And this is about a partnership. It's about making sure business leaders, the community, employees are all working together. And to date, the collaboration has been outstanding. To date, we've had very positive feedback from businesses and employees wanting to do the right thing. And of course, government is there to support those important decisions.
Premier, this attack on the St Mary's Clinic, apparently there was a graffiti that said COVID is a hoax. You must be incredibly disappointed by that.
Look, it's always disappointing when people choose to ignore the health advice or pretend that COVID isn't a serious illness. But fortunately, those people are in the minority. But it is a reminder to us that unfortunately a minority of people do have those views and demonstrate them from time to time, and that's the threat of Delta. Delta doesn't leave any room for error. I know that the decisions the New South Wales Government has taken and the language we've used and the way that we're dealing with COVID might seem confronting because it's the first state in Australia that's had to make these decisions and learn to live with COVID. But this is the way for all of Australia into the future. And those people who think COVID isn't a serious disease, or those who think we don't need to take the action we're taking, are in the minority, fortunately.
Premier, can I ask one more?
Of course.
It's either late in the evening or early in the morning when you get those figures. Today it's 6 dead. Vaccination numbers are great. But when you hear 6 people have died, that's a lot to take in.
Oh, look, obviously you want to protect every single life of every single citizen, and what we can do is warn people as to how you can protect your loved ones and warn people as to what you can do to be COVID safe. But what I'm encouraged about is, given the number of cases we have and given how long this pandemic has run for, compared to the rest of the world in populations similar to New South Wales, we are doing incredibly well. Now, if you're the relative or a loved one of someone who's died from COVID, obviously that's difficult to hear. But if we put things into perspective, if we put things into where we are now compared to other parts of the world, we're still doing well, but obviously I want us to do better, and the way we do better is by living more freely and having higher rates of vaccination. And I'm incredibly proud of the fact that New South Wales started where we did. We've maximised the supply that we've been given in the best way we can. We've targeted those communities that need the vaccines the most. And as health and we have said in the last few weeks, we're hoping that by mid-September we'll see a dramatic change because the rates of vaccination will increase and the impact of the jabs people are getting today will obviously come to fruition in 2 or 3 weeks. So we know it's an incredibly difficult time. It's a scary time. But it's also a time for us to look to the future with optimism and hope, and to look to the future as New South Wales, perhaps showing the rest of Australia how you can live within a pandemic, live relatively freely, but also make sure that you're keeping people out of hospital. And, for example, given the case numbers are where they are, I suspect in October we'll probably have the highest number that we do in intensive care. I suspect we've not reached the peak yet there at all. But how hard we work now will make sure we keep people out of hospital, and that's really important.
Has said previously to use the ambulances like a taxi service given the rise in cases and to not worry about the costs associated. But we're hearing from paramedics that they're under a lot of pressure. Can you assure people that they will have access to an ambulance if they need it, if it's not to do with COVID?
Firstly, can I thank our paramedics for doing the outstanding work that they're doing. They're on the front line, picking up patients when they're in desperate need of hospitalisation. And as the medical experts have said during the week, whether it's our public health team or whether it's medical practitioners that are actually working in intensive care, if you are a young person experiencing breathlessness, you must ring an ambulance. So we know when it's incredibly important for people to ring that 000, get the medical attention and come straight to hospital. But I think people can also make sure that if they're of concern, if their health is of concern, if they think they need that emergency treatment, don't hesitate to ring 000. But please know, if you're not having a serious episode or you're not having those serious symptoms, I think people need to be reasonable during those times as well.
Premier, throughout all of this that you've had, and probably a follow-up, same question actually for Dr McAnulty, for both of you. You've had to balance the economic interests with the physical safety aspect, with the emotional. Child self-harm is up 30% through this. That must be distressing to you and Dr McAnulty as well in terms of whatever resources you can funnel towards that. How do you factor that into your decision-making going forward?
Oh, look, it's especially concerning to see the mental anguish that people are going through, especially young people. And that's why New South Wales has always taken, or tried to take a balanced approach. Yes, public, whenever you're in a situation where you've got high levels of lack of vaccination and high case numbers, you always worry about the number of people that are going to go into hospital. So public health is always your first priority. But that has to be balanced against mental health issues, and that's why I was keen to provide an incentive for our citizens once we got to those 6 million jabs. As modest as they are, they're important steps because they show that once you increase rates of vaccination, that means we can take the pressure off families, take the pressure off young people. And we all remember when we were younger, when you're young, the world you see things differently as to when you're an adult. And we appreciate those challenges families are going through and anything we can do to relieve that. And again, I repeat what I said earlier. I'm especially concerned about families in Western and Southwestern Sydney who have very strict lockdown provisions imposed on them at the moment. And if there's some relief we can offer at any stage, including when we get to 70% first doses, then of course we'll consider those because I want us to continue to have a balanced approach. As I said, from day one we've been criticised no matter what we do. We will continue to make decisions that are in the best interests of our citizens. I don't ever shy away from that. And I'm happy to take any criticism levelled at the government because what we need to do is ensure the balance and know what a stressful time this is for people. those of us who've got means to cope with it find it difficult enough, let alone children and adolescents. And anything we can do to relieve the pressure on families, we will. And when those vaccination rates continue to climb, that gives us opportunities for greater choices and decisions.
That same question, please, to Dr McAnulty in terms of resources. I mean, you obviously spend so much of your time looking at the physical manifestation of COVID. What about the mental?
And I preface it by saying I'm not a mental health expert, but I understand there has been an increase in presentations, both acutely and to emergency services for people with self-harm. But that's a trend that's happened over a relatively long period, and experts are still trying to untangle how much is COVID-related and due to other causes. But of course it's very concerning, and we all need to support those people who are presenting, both in preventing and helping manage their anxiety. Of course, COVID is an extremely stressful time for all of us, particularly if you're in situations as we are now being locked down, or if you're a case or a contact of a case and you're anxious about your physical health. That's inevitably going to have an impact on your mental health. However, the experts have been looking at this in New South Wales and have enhanced some of the support and prevention services, and we can get you more details of that later on.
The CMP in the following story about is saying that there needs to be a temporary medical facility set up in Wilcannia right now. I know that extra resources have been sent there, but there is a crisis unfolding. He said it's going to get worse over the week, and there's adequate plans not put in place for that. Are you prepared to send more or do more for that community?
Oh, look, all the briefings I receive give me a great deal of confidence that our state and federal authorities are working really hard on the ground, and our government agencies are working together across the board to support the community of Western New South Wales. I appreciate many different people will have different views on what we need to do, but all the briefings I've received tell me that whilst the situation is concerning, that all the federal and state government agencies on the ground are working incredibly well together, especially our health services, our police services, but also family and community services, all government agencies. And I really want to thank our Indigenous community leaders in particular for the role they've played in supporting our efforts to vaccinate as many people as we can, but also to make sure people ask for medical attention when they need it as well. So as difficult as the situation is, I'm grateful for the federal and state government agencies on the ground, including the Royal Flying Doctor Service and all the agencies that have come together to provide support. And on a daily basis, I know that our teams give us feedback on what needs to happen. If there's more to do, of course we will. But until this point in time, all the briefings that I'm receiving give me a good deal of confidence that support is being provided where it's needed.
Can I ask, we're used to seeing police at these press conferences too. So in the past week or two, you've led off the press conferences not with the grim numbers, but the more positive, hopeful numbers, the vaccinations, etc. Can we ask, from a public relations point of view, are police not here simply because you don't want people to feel battered by the message?
No, it's important for us to make sure the community gets the most important messages of the day in relation to vaccinations, and I can't stress that enough. But we will provide updates to the community if and when they're needed, obviously. But our focus is on keeping people out of hospital. Our focus is to make sure that we increase the vaccination rates. As you know, we were very keen to make sure that we had one last announcement of all the restrictions that are in place, and I want to thank the Police Commissioner for his support and leadership in that regard. And now it's a time for us to implement what we've put in place, and updates are always provided to the community. In fact, I think if you compare the information we provide compared to other states, you'll find us extremely transparent in all the information.
Premier, there was an article in the Sydney Morning Herald in the last couple of days alleging that you find Scott Morrison is a bully and that he's evil. What do you say?
Can I thank the Prime Minister for his support in during the entire course of the pandemic, but especially in relation to this outbreak. Those extra doses of Pfizer that he was able to give to New South Wales are making a real difference. And I've thanked him privately. I also want to thank him publicly for that incredible support, because those extra 500,000 doses are getting into arms and making a difference in our battle in living with COVID.
You're not denying having said
I completely say do not believe what you read. I always say believe...
Yes or no, Premier?
Well,
have you described Scott Morrison as a bully?
No. And can I say this? A number of times, and some of you in this room may not like what I'm about to say, a number of times I've read things during the course of this pandemic which haven't been based on fact. I always say, please listen to the briefings and what we say here, because that is fact. Thank you.
Just in terms of that extra Pfizer, there was a bit of concern last week that not enough bookings were being made for that extra in those targeted areas in South West and West. Are you confident that you'll get through that extra Pfizer?
Yeah, the most recent briefing I had, I think, said around 400,000 people have already booked, which is fantastic. And as you see, in the last week, to have 874,000 people come forward and get the jab is an absolute record. We're approaching 1 million jabs a week. And for a population of 8 million people, that is outstanding. Thank you. It is making a difference. We are going to show the way in Australia as to how you can live with COVID. And I'm so deeply grateful that, notwithstanding the stress and frustration that everybody's going through, people are coming forward, and please keep doing that. We will stick to our word, no matter what the case numbers are doing, and of course we want to see them come down. Double dose, 70% in New South Wales means freedom for those who are vaccinated in New South Wales. And it doesn't matter where you live or what your circumstances. Once we hit 70% double dose vaccination, our citizens will feel much freer, much more hopeful and much happier than what we're all feeling at the moment.
Can I ask, if your number one priority is to get to 70%, society opens up a little bit more and a bit more at 80%. What happens if hospitals become overflowing with people and the Chief Health Officer suggests a citywide lockdown again? Are you prepared for that?
This is the whole point. The point of getting to those vaccination milestones means you don't have lockdowns in the future. It means you manage the disease. But what it might mean is that from time to time you ask people to do things a bit differently, whether it's density in a venue or whether it's the amount of people you have at a major sporting event. So there'll be opportunities for us to move levers up and down, but no way will we need a statewide lockdown once you get to 80% double dose. And that's the key number that we need to get to. 70% double dose gives us lots of extra freedoms for those that are vaccinated, but it does still mean we use QR codes. It does still mean we have good social distancing, that we follow the health guidelines, but it means a much freer existence than what we have now.
We've got 126 people in ICU today. You said it could potentially go up. Have you seen modelling to see how much it will go up? And what are you comfortable with in terms of opening up if we reach that 70%? How many people are you comfortable with in ICU per day? Well,
what we can do at 70% double dose will depend on the case numbers and how many people are in ICU. So whilst we'll have more freedom than what we do today, the extent of the freedom, the extent of what we can do will depend on a whole range of factors. But that is why I don't want to see anybody in ICU. We don't want anyone to have to go through that. COVID is a horrible disease, especially when you get it in a serious way. It's a horrible existence. And we don't want anyone to have to go through that. And that's why the quicker we get those vaccination rates up, the lower the number of people that will end up in ICU. And remember, there's always a lag, so it takes a few weeks before people get the disease and then succumb to it in a serious way and then end up in ICU. So I anticipate those numbers will go up from what they are now, but our system will cope. We've been planning for this. No doubt the health system is stretched. No doubt there'll be days when people will feel overwhelmed, especially our health staff who are just doing an incredible job. But this is what we've been working towards, to make sure our system can cope. And when you move forward to 70 and 80% and open up, you have to accept there will be people who aren't vaccinated and sometimes those that are, but very rarely. We've only, I think, had 2 examples of double dose vaccinations ending up in intensive care. So the vaccines, it really is a pandemic and epidemic of the unvaccinated. No doubt about it, if you look around the world and even around Australia. So the message is get vaccinated, protect yourself and your community, because hope is just around the corner. October will be here before we know it. But obviously, before then, if local government areas are demonstrating a decline in numbers, there'll be opportunities for us to act in that regard as well. Thanks, everybody.